When I was in Savannah, I had an emergency C-section. My husband was approached about getting my appendix removed while I was opened up. Now that we live in Illinois and it's been 16 years, I'm not sure if I still have an appendix. It would really be helpful to have records that were easily transferred from state to state.
I had, back when I was about 7 or 8 years old, I developed what the doctors thought at first was the mumps, and it wasn't. It was a gland infection, and I was bedridden for the better part of 3 months. I had an older doctor I went to on every occasion. And I would have no more idea in a man on the moon where those records would be at today. And if they followed me, I'd have no idea.
Distinctly remember about 2 years ago, I changed personal care providers. And last year I went to my new provider, and because I had to have a mammogram done, and they were not able to access my previous records from my previous mammogram. And so I distinctly remember I was very frustrated because I had to actually drive over and sign a consent form to really have that information released. I think it would have been really nice if that information, if my current physician could have accessed that information online.
I don't have a problem with them going on computer. Makes it easier for the doctors, whatever, because if your social security number is out there anywhere, at your bank, anywhere, people can get all the information they want about you and get into any of your records anyway. So what's the big deal?
Okay, so the best example I have is when I went into premature labor with my son Colin, and I contacted 911 and told them my history as far as how many weeks pregnant I was, what my blood type was, what I was diagnosed with so that they knew what I had. And then when 911 showed up, they actually went through all the procedures, got me stabilized, got the ambulance ready. But however, by the time I made it to the hospital, because I had a nice police escort, by the time I got to the hospital, none of that information I had given to 911 was translated to the emergency room, nor any of the physicians. So some of their decisions when I was in the emergency room were kind of those generic ones. So even though I had given them the blood type that I was, which was B positive, they gave me the universal. Not necessarily bad, because of course it saved my life. However, because they gave me the universal, I had an allergic reaction to the blood, and so I woke up and I had hives.